Good afternoon, everybody, and welcome to the next installment in our webinar series on cultural safety and humility. A big thank you to our partners at the BC Patient Safety Quality Council and today's partner, Northern Health, in putting together today's session. My name is Davis McKenzie, and I'm the Communications Director at the First Nations Health Authority. My ancestral name is Kwakwaju, that's my baby name, it means squirrel. My adult name is Ajay Masawat, and that means making the change. I'm from Tla'amin First Nation and really honored to be your host today. Today's session is around growing cultural safety in northern BC. So we have a really great geographic focus and I think a really great partnered presentation coming from Northern Health and some of our team members at the First Nations Health Authority who you'll meet in just a little while. First off, we're looking to cover some quick housekeeping items, and then we'll move into the session proper. So if you're wondering where the opening protocol is, we're going to move through the housekeeping really quick, and then we'll get into the proper opening prayer and protocol, and then we'll hear from our exciting lineup of presenters today. So I think without further ado, I would encourage all that are on the line to please do introduce yourself in the chat box. We're so happy you've joined us today and look forward to a really great session. Bear with my technical skills. Great. So there's a few things that our folks on the line should know about interacting in the WebEx capacity. I think importantly is that there are a few ways that you can engage. So the WebEx is a two-way solution. There's the chat box through which you can offer commentary or ask questions, but you can also raise your hand. So as we move through the presentation portion at the beginning and then move into the Q&A, there will be an opportunity for you to raise your hand and ask questions and interact with our wonderful panel of presenters. We want to ensure that everyone's audio is working so that you can effectively engage in the webinar. Our technical expert, Sue from BC Patient Safety Quality Council, is online with us today supporting this. I think importantly, we've muted everyone as you've come in. That really helps us to cut down on the background noise. But as we move into Q&A, we can unmute you to hear your question and answer. A couple of more key points for you to take a look at around our technical requirements. I would encourage anyone having difficulties hearing to please just type into the chat box and we can enter into a private conversation to support you in getting your audio up and running. Chat. So from prior experience, chat is where a lot of the action happens in these sessions. As you have your aha moments or just other questions as they arise, please do pop them into the chat box and we will be using that to commence our Q&A session at the end. Importantly, this session is being recorded, so all of the sessions to date have been recorded and shared on the FNHA and BC Patient Safety Quality Council websites. So you can go there and review any of those, but just important for you to know that we are recording. Great. For our social butterflies on the line, we do have a number of ways to also engage with this content. So let's let the rest of the world know what's happening in the session and tweet out, I think, our learnings. We've got our handles and hashtags identified there. Please use any of those. Just a note, in one of our prior sessions, we did actually get the "It Starts With Me" hashtag as a trending hashtag. So don't be shy and do tweet out and encourage others to join. I think importantly, we've put in place here a bit of a trigger warning. So there, in these sessions, sensitive topics and subject matter does come up. We just encourage folks to have in place those supports And we have posted here a crisis line should any of this content trigger you. Great. So without further ado, I'm going to turn it over to Verna Howard. Verna, we'll do our proper introductions following the prayer, not wanting to get in the way of protocol. So if I may, Verna, I'll turn it over to you.
Thank you, Davis. We'll just start off with a prayer, which is a proper protocol for First Nations throughout BC. So we'll all pray. Pray to God, we ask for your guidance today as we proceed to share the information that has been developed through Northern Health and the AHIC. We ask you to support all those on the call and to expand on their needs with regard to the cultural safety and cultural humility that is shared here. And we pray that you will continue to bless each and every one as we go throughout the WebEx. We pray this in your precious name, Jesus. Amen. Thank you.
Thank you very much, Verna. And I think we don't want to take too much time away from the panel, but I would like to offer some proper introductions here. So we've got a very, very dynamic panel assembled today to talk about cultural safety and humility in the North and some of the great progress that's being made. So I'll introduce in order of speaking. So first off, you're going to hear from Victoria Carter. Victoria is the lead for engagement and integration with Northern Health. She is a sixth-generation settler of European ancestry and an adopted member of the Niska Nation. Her Niska name is Nosamagu, which means Mother of Good Heart. Hope that pronunciation was okay, Victoria. She works with the Northern Health Indigenous team in Terrace and on the traditional territory of the Tsimshian First Nation. Up next will be Hilary McGregor. Hilary is the lead for knowledge translation and community engagement with the Indigenous Health team in Northern Health, and she's been in this role for over 3 years. She supports the communication needs of the team, the development of resources and tools, and has worked with AHICS to support local cultural resource development. Welcome, Hilary. Sandra Garbitt. So welcome, Sandra. Sandra was born and raised in Northeast BC. Her parents were members of the Treaty 8 territory, and she is a mother of 3 grown children and a loving grandmother to 5 grandchildren. For the past 19 years, Sandra has worked and lived in Fort St. John, primarily in the public service industry. Growing up in the Northeast proved to be challenging, and racism was a struggle on a daily basis. Health became a passion for Sandra when she received the lupus diagnosis in 1988. Support groups at the time were bleak, and members were dying at an alarming rate. She's decided to take matters into her own hand and began a regimen of self-care that kept her away from typical treatments. Sandra joined the AHIC in 2008 and has been sitting at the table since. She has been around to see all the new faces, changes, and growth. Welcome, Sandra. And finally, Verna Howard is of Gitxsan descent from the House of
Haydn.
Thank you so much, Verna. Her wing chief name is Ligli Galwi.
Galwil.
Thank you, which means to attach herself to others. She is employed with the First Nations Health Authority as a community engagement coordinator, serving 8 communities in her engagement area. In the past, Verna's worked as a health director for the community of Gitxsan over 7 years, also as a community health planner, and directly in suicide prevention, postvention, and support. We're so excited to have you with us today, Verna. With that, I think we will turn it over to our first speaker, which is Victoria.
Hi, everyone. Thank you, Verna, for the opening prayer and Davis for the introduction. Thank you to the organizers for this webinar series, the First Nations Health Authority and the BC Patient Safety and Quality Council for having us here today. On behalf of Hilary and I would like to thank our partners, Verna and Sandra, for joining us on this webinar. As mentioned, my name is Victoria Carter, and I'm the lead for engagement and integration with Northern Health, Indigenous Health, and my Niska name is Nox Amagot. Amasa Has Nisam, good day to you all. I'd like to acknowledge the traditional territory of the Tsimshian Nation on which I live and work and from which I am presenting today, and just take a moment for everyone to acknowledge the territory on which they are currently today as well. We are really pleased to be here to share some exciting work underway in northern BC on the cultural safety and humility. We will begin by providing a brief context for partnering in the North and review definitions of cultural safety and humility. The presentation will continue with information about how we are growing cultural safety in northern BC, including resources and initiatives at Northern Health and local cultural resources and initiatives undertaken in partnership by the Aboriginal Health Improvement Committees. Next slide, please. Northern Health works in close partnership with the First Nations Health Authority to enhance the health and wellness of Indigenous people in the northern BC. One of the key ways we collaborate is on the Northern First Nations Health and Wellness Partnership Committee. This partnership committee is part of the new First Nations Health governance structure in BC. It was established to implement the goals of the Northern Partnership Accord signed in May of 2012. I will now pass the mic over to Hilary for the next slide.
Hello, this is Hilary with Northern Health. And before I continue with the presentation, I'd just like to take a quick moment to acknowledge the traditional territory of the Lheidli-T'enneh, where I live and where I'm speaking from today. So in July of 2015, all BC health authorities, including Northern Health and the Ministry of Health, committed to embedding and hardwiring cultural humility and cultural safety within health services. The declaration gives all health professionals a mandate to advance cultural humility and safety in their practices with Indigenous people in BC. And as well, in March of just this year, 23 health regulatory bodies in BC also signed the Declaration of Commitment to Cultural Safety and Humility. Next slide. So cultural humility is a lifelong journey of self-reflection and learning. It involves listening without judgment and being open to learning from and about others. It involves learning about our own culture and our biases. And cultural humility is a building block for cultural safety. Next slide. Cultural safety is achieved when all people feel respected and safe when they're interacting with the healthcare system. Culturally safe health services are free of racism and discrimination, and people are supported to draw strengths from their identity, culture, and community. It also addresses the power dynamics that are also inherent in healthcare encounters. Northern Health values include empathy, respect, collaboration, and innovation, and cultural safety really grows when these values are applied to the context of cultural differences. Next slide. So next, we'd just like to share some of the resources and initiatives that are underway at Northern Health to support growing cultural safety in the healthcare system. Next slide. So this spring, we launched a brand new website that was built as a resource and a place of engagement for Northern Health leaders and staff, as well as for Indigenous community members and organizations. The site was developed to provide a clear and accessible information with an elegant design that speaks both to the head and to the heart. It has the potential to grow with our work as we develop more ways to share information about cultural safety and humility. One of the exciting features on this site is an interactive map as a one-stop destination for locations and contact information for Indigenous communities and health centers, for friendship centers, and for Métis associations in northern BC. The map provides a glimpse into the past that still resonates across landscapes and in communities by including the location of 5 former residential schools. It also provides location and contacts for Aboriginal patient liaisons and Northern Health Aboriginal Health Improvement Committees. So I invite you to visit our website, and the URL is just at the top of that page, and take a look around at some of the resources we have available there. Next slide, please. So this is a webinar series that's hosted by the Indigenous Health team at Northern Health, and the intent is to introduce all of the 8 Aboriginal Health Improvement Committees, or AHICs, and highlight the local cultural resources that they're developing and have developed. The first webinar we've already hosted introduced the North Coast AHIC, and the second webinar introduced the Terrace Kitimat AHIC. This webinar focused on the topic of cultural safety, and it includes rich discussions and sharing by AHIC members. And we're planning additional webinars approximately every 3 months, and the recordings are available on our website. Next slide, please. So we recently released a short animated video that introduces cultural safety and related concepts in an easily understandable way. It's just a short 5-minute video. It invites healthcare providers to participate in making the health system more culturally safe for Indigenous people and families. And there's a booklet that goes along with it that includes terminology, factors contributing to a culturally safe healthcare system, and features of culturally safe practices. Next slide, please. These are a few of the resources published by Indigenous Health to support cultural safety in the healthcare system. The first booklet summarizes the more than 50 local cultural resources and initiatives developed by Aboriginal Health Improvement Committees since 2014. These local cultural resources support increased knowledge, understanding, and cultural safety of care to Indigenous people, families, and communities in northern BC. The second booklet clearly summarizes the steps and processes available if you have questions, concerns, or complaints with your healthcare experience. It encourages Indigenous people to voice their concerns with their healthcare experiences so that the issues can be addressed and healthcare experiences improved. And one of the key features of a culturally safe health system is a clear and accessible complaints process, and this is our effort towards that. This third booklet here summarizes the spaces available in Northern Health buildings and grounds for family and community members to gather, and it provides contact information for local Aboriginal patient liaisons and a regional spiritual health manager. And this is a booklet that offers a place for healthcare providers and family members to start navigating their needs within healthcare spaces. Next slide, please. And finally here, the Northern Health and AHICS have been encouraging participation in the First Nations Health Authority Cultural Safety and Humility campaign. Many Northern Health individuals and teams have made pledges, including the Executive Committee, which is pictured here at the top. And there's some beautiful displays of pledges in locations across Northern Health. This here is a wall of pledges in Prince Rupert Regional Hospital that was initiated by Mary Wesley, the Aboriginal patient liaison there. And it includes Northern Health staff and AHIC member pledges. Next slide, please.
So back to me, it's Victoria here. I'd like to provide an introduction to AHICS, Aboriginal Health Improvement Committees. Next slide. Aboriginal Health Improvement Committees are action-oriented, collaborative groups that work together to support health and wellness for Indigenous people, families, and communities in northern BC. 8 Aboriginal Health Improvement Committees operate across the north with membership from local Indigenous communities and organizations, the First Nations Health Authority, Northern Health, and other sectors. AHICS identify local healthcare priorities and work together towards practical solutions. They build connections by providing opportunities for new and stronger relationships. Much of their work increases cultural understanding between diverse communities and sectors, as well as incorporates Indigenous people's perspectives and experiences in healthcare programs and services. You can see the 8 pictured here across the north and the areas that they cover. In 2014, 2017, to 2017, Northern Health and Aboriginal Health Improvement Committees supported Indigenous communities in northern BC to develop local cultural resources that highlight their own ways of being, ways of knowing, ways of living, traditions, cultures, protocols, and environments. These resources will support increased knowledge, understanding, and cultural competency of healthcare practitioners that provide care to Indigenous people, families, and communities in northern BC. Sandra, Verna, and I will share some examples of these resources. As mentioned, there's so many, so we can't cover them all, but Sandra will start us off by talking about resources in the Northeast.
Good afternoon, everybody. Firstly, I'd like to acknowledge the territory that I am currently calling from, which is the Denizah territory. It is the traditional territory here, and we are also in the Treaty A territory. This first slide was completed in May 2015 by Sequoia Heritage Society. The contractor was from the Northeast and worked out of the Treaty A Tribal Association. So they completed this project then The material gathered took several months to compile, as the geographical distance to visit the nations individually was too vast. Treaty 8 Tribal Association was also in the midst of compiling and completing a project that would bring a number of the elders together. SEQA was able to take full advantage of this opportunity. This report was developed after several years of issues being raised at the AHIC table regarding lack of understanding, insensitivity, unfair treatment, and it was decided at that table that we would work at closing those gaps and bring some awareness to our partners. Northern Health Authority, along with partners at the table, First Nations communities, agreed that compiling this general information for some people it's viewed as simple, but the information within is quite valuable to our service providers in the Northeast. We have selected a few slides from this document simply to make reference to and to identify the relevance of this document for service delivery. The plant pictured is a rat root known for its vast medicinal benefits. Next slide, please. Next slide. Hello? Oh, sorry.
Did it catch up for you?
Yeah, I got it. Perfect.
Okay.
Okay. So this slide is specific to death and dying. There's a reference to tobacco, drumming, smudging. So for those within the service industry, probably some who work in the hospital, it's not uncommon in the Northeast to hear drumming and singing at a funeral or when an individual begins their journey to the end. Next slide, please. Okay. This slide from the project provides insight into the roles of men and women. This page also makes reference to early settlers actually seeking out the assistance of First Nations women for medicinal purposes. The small quote on the left speaks to the importance of living life in balance, as well as the importance of oral history, traditional teachings, and the culture. Indigenous women's knowledge of plants was particularly valuable when communities encountered new diseases. Plants were used to treat stomach aches, sore throats, cramps, swelling, headaches, heartburn, hemorrhaging, diarrhea, fevers, mental, spiritual illness, and so on. Willow bark was invaluable for treating bronchitis. The bark of a willow contains psilocin, an active ingredient in aspirin that helps soothe pain. Yeah, I just want to read that a little bit. So next slide, please. This slide provides historical context surrounding the Treaty 8 signing. It should be noted that the Northeast is the only numbered treaty in BC and was signed in 1900 with a couple of the communities joining later on in 1910. And next slide. Okay. The Northeast BC Aboriginal Community Health Resources was completed this March. Brittany Brinkworth, the Aboriginal Patient Liaison in the Northeast here at the Fort St. John Hospital, as well as Elisa Fro, a community engagement worker with First Nations Health Authority, worked in collaboration to ensure that information included was up to date and accurate. The health resource provides some key information for service providers in our urban centers to connect with health leads in the community and prepare the patient, client, and community to lend their support when a patient or client is being discharged. The patient information wallet card is an idea that the Northeast AHIC adopted after our 2016 AHIC gathering, where the Ominika AHIC presented the concept. This card will identify the elder's name, home, community, nation, first language. Language barriers plays a huge factor in communication and understanding and service delivery. This is an excellent tool for our elders and helping bridge that gap. I believe I'm done. Thank you.
So growing cultural safety in northern BC with Northwest AHIC is the one I'll be covering. This is Verna Howard. And I'll acknowledge also the nation whose territory I'm still on, my office is based out of. It's the Gitxsan Nation. I acknowledge the territory. And I would also like to acknowledge the other nations that we work with on the Northwest AHIC. And that's at the AHIC table, we have the Haisla, the Tsimshian, and the Nisga'a, along with Gitxsan Nation, that sit together to do the work with Northern Health. Next slide. The slide before you is the cultural learning session that we held in Hazelton. This was, the cultural learning session was put together to create awareness on the culture of the Gitxsan and the Wet'suwet'en First Nations people. So we put together a cultural learning session that was World Cafe style. We had workshop stations. There's about 5, 6 workshop stations that we had there. And we had various presenters do presentations on various topics. We had the, as you see there, we have Ron Mitchell, who sees Wet'suwet'en. We have him presenting on Wet'suwet'en 101. We also have Ardeth Wilson, and she presented on Gitxsan social structure and traditional wellness. We had John Ridgedale. He presented also on the, Ron Mitchell presented on impacts of colonization on the First Nations people, and John Ridgedale presented on Wet'suwet'en 101. Vicki Russell presented on the Gitxsan social structure, and we had Mel Basil who presented on the implementing culture with mental health programming. So we had various topics, and people would circulate, after, I think it was 20 minutes, they would, presenters had to present, and then we had 10 minutes Q&A, and then they'd rotate to the next table of their choice. But in order to put this together, we also have to follow protocol of the nation whose territory we're on. And protocol is to make sure that we have invite the hereditary chief to do the opening welcome, and also the band councils, because they both serve as the leadership for the communities that they're working with. We also invited the Gitxsan performing arts dancers to perform, and to let people have the experience of seeing what their cultural dances involve and our traditional songs. We also had our local elder do the blessing before the lunch was served. And during lunch, we had the video presentation. 2 videos were presented, and it was the 2 videos that we produced in earlier work that we did with the AHIC, and it's cultural practices on terminal illness and death. That's the first video, and the second one was Gitxsan cultural practices on birth. And the whole idea of those was to create awareness with the hospital staff why we congregate the way we do when there's various occurrences, life occurrences that happen, and so that they'll know how to handle the situation within the hospital system. So we had also, when moving on to the next slide, we have the sharing feast. The sharing feast is where we had the Northern Health and First Nations Health Authority cost share to implement a feast. This is not a normal feast that we would have. It's based on our culture and our tradition, but we changed that up a little bit because we normally do not have PowerPoint presentations at our feast. And our feasts are also conducted to carry out business for the clans. So when we implemented this, we made sure that people were aware that we were not taking care of business. We are just sharing our information. And there's a lot of work that the AHIC has done, and the communities are not aware of it. So we're also taking it out into the community to share with the communities. And our communities do not, members, First Nations do not normally attend a workshop or any kind of information sharing if it's done in the Western approach, with a Western approach. So to make it more relevant to them, we implemented this information sharing at where they would be comfortable, and that was an information sharing piece. That's a huge approach because I can see the numbers. Normally, if we had an information sharing with a Western approach, we would have probably a dozen people in attendance. But you see the photo there, we have over 100 people in attendance listening to the presentations. And the presentations were given by the Ridge Memorial Hospital. Update was given by Mary Vanstone with regard to the projects that were AHIC projects that were implemented there. We also had the Aboriginal Patient Liaison share the work that she's been doing at the hospital, and also the AHIC projects that we worked there. We also had the Hazelton and Area Recreation Center present on the new facility that will be started this summer, and they'll be building that, and so he needed to do a presentation, so we had that. So we had food and giveaways that were handed out. We fed the people, and we gave them information, and we gave them giveaways at the end. So this is a huge deal for people, and a very excellent way to gather them. Next slide. So this is the Gitsan phrase book, which was worked on by the Aboriginal Patient Liaison. Angie Coombs is the one pictured there, and she's actually part of the Gitsan Performing Arts, but she's also the Gitsan Aboriginal Patient Liaison at the Ridge Memorial Hospital. So she and Victoria Carter worked on this Gitsan phrase book for healthcare providers. The idea behind that is that we would teach our local health professionals the basic phrases, Gitsan phrases, in terms of to support the work that they do in the hospital system. The basic things such as saying Gitsan language to say hello, goodbye, how are you, how are you doing today. There's a lot of little phrases in that little book, and it's a pocket size so that the health professionals can carry them, and when they have elders especially that they have to work with, it's a way to connect with the First Nations person and reduces that fear that they may have with being in the hospital system, and opens doors for communicating. So it's a real good tool that is helpful to both the First Nations person and to the hospital staff. Next slide. So this unveiling of Gitsan art at Ridge Memorial Hospital was a project that we had in to have wall hanging in the hospital. This was commissioned by the commissioned work, and it was also sponsored by the AHIC. And the crest is depicts the Indian residential school experience from the Gitsan perspective, and it's also made by the residential school survivors participating in the Gitsan Health Society Indian Residential School program. So it was made by Michelle Stoney, and whose grandparents survived residential school and now actively promote Gitsan history and culture. And the crest represents the 4 clans of the Gitsan Wilp inside a mother and child, portraying the matrilineal foundation of the Gitsan nation. It's a powerful representation, actually, for those that survived the Indian residential school. It shares that you're always connected back to your mother clan, because Gitsan are matrilineal. And we had also to carry out this. We followed protocol. We had of the Gitsan nation. We had the opening in prayer by the local elder, and then we also had the welcome by the traditional hereditary chief there. We also had the celebration, which was held in the cafeteria where refreshments were served, and the Kasan Performing Arts dancers also performed. And it's the first time that there's ever been any First Nations event held in a hospital, in the hospital there. So there's a huge deal to have it there. And there's a number of elders that are being taken care of in the hospital. They were there, they witnessed everything. And you could see the big difference that it made on their faces to see that something of their culture was being brought into the hospital. A huge, huge deal. And the next slide, please. This project is one that we're currently working on with the Gitsan West communities, that's the communities that Kitchukla, Gitwangach, and Gitnyao. This project came about because we've seen the need that there's make culturally relevant program planning for the mental health system and the care that is provided, support that's provided for our First Nations people in the Gitsan West communities. Most of our people are not, do not welcome the Western approach. They're still fearful of it, or they still do not trust the system. And so we're working now to try and reignite the culture and empower the people again to recognize how they can work with the Western system. And so we're drafting, we're compiling information to make sure that we have a basis and a foundation for the work that we're doing. So we have participants such as Gitsan cultural knowledge holders and health leads that are working on this working group. And we have Gwehle teachings that's sharing teachings that are brought forward by the knowledge holders, and we document those. And it's more of a fluid approach to compiling and documenting the information, setting the foundation for the Gitsan mental health support system. And it's still in progress. And next slide.
So I think this is over to me now. It's Victoria again. Thank you, Verna. And building on what Verna has just shared, the Aboriginal Health Improvement Committees across the North have done a significant amount of patient journey and process mapping together. And in this picture here, this is in the Hazeltons. And as Verna was mentioning, it was identified that cultural supports are a core strength of wellness in the communities, and it was important to find ways to ensure they are included in patient journey and care relationships. So coming in the next slide, we are taking projects such as the one Verna just shared on reigniting culture within mental health, together with other projects that the AHICS community members have done. And we're coming together to build on these mapping events and what has been identified. And actually tomorrow we're having a celebration in Kitsillis where we'll be showcasing 2 AHIC members, Northern Health, the First Nations Health Authority, the local Indigenous community members, and other sectors, the work that we've been doing together to collaboratively and in the communities to develop community-driven cultural-based mental wellness. So this includes the project Verna just shared, as well as a Kitsillis youth video and a Niska Valley Family Conference. And the intent of this celebration is to showcase how culture heals and to learn from each other on how communities are doing this and to establish new partners and pathways for collaboration around mental wellness. Next slide. Other examples of resources the AHICS have developed are videos. The Amanika AHIC, the North Coast AHIC, and the Terrace Kitimat area AHICs have all developed videos to help staff understand their local culture and healthcare needs. The North Coast AHIC has also launched their video in many of the communities and on Haida Gwaii, the coastal communities, and in Prince Rupert to share this with community members as well as with Northern Health staff and other sectors. Pictured here is the launch of the 2 videos Verna mentioned earlier, which was cultural practices around illness and death and cultural practices around birth. Thank you. Next slide. So one other example that we're going to share today before we close is an example of resources and partnerships developed is the development of posters and pamphlets that help community members understand how the emergency department works and how best to get the care you need in the healthcare system. These posters and pamphlets were developed in collaboration between Indigenous patient volunteers with the Patient Voices Network, First Nations Health Authority, and Northern Health staff. Northern Health leaders and staff have recently consulted with the Haisla Nation in Kitimat Village about these materials, and that consultation led to even greater two-way understanding. These are just a few examples of some of the resources developed today. There's a lot more, and we encourage you to look at our local cultural resource booklet that Hilary mentioned earlier. Next slide. So thank you for listening to our presentation and how we are growing cultural safety in Northern BC. We are happy to have had the opportunity to share some examples of our work underway in the North. We will now pass this back to Davis, who will facilitate the discussion. Thank you.
Great, and thank you again, Victoria, Hilary, Sandra, and Verna for your very in-depth presentation. I think the resources reviewed provide a really great place for anyone to start on their own journey in cultural humility toward cultural safety. And I think really appreciating a deeper dive into what's happening in Treaty 8 and Gitxsan territory. So thank you so much for those overviews. We'd now like to turn it over to you, to the participants online, for our question and answer portion. So please feel free to either just raise your hand, which you can do where you see your own name in the right-hand side, or type your question into the chat box, and we will do our best to answer those. So I think now over to you for Q&A. So we have our first question, and this is from Katie Proctor. Katie's commenting that this is amazing work, and she notes that funding is key in this work. And how did you secure the funding necessary to do this work together? And maybe we'll start with Victoria and take it from there.
Hi, thank you. Yes, thank you. We're really excited about this work, and we need to acknowledge Dr. Margot Greenwood, our VP with Aboriginal Health, who oversees our program in Indigenous Health, and she has been giving the Aboriginal Health Improvement Committees funding each year to create and develop whatever they feel is relevant. So that's where the funding from the AHICs come, and then the resources that Hilary mentioned are through the Indigenous Health program in Northern Health. That's where the funding comes. Thank you.
Great, thank you very much. We have our next question coming up, and this is coming from Allison. Can you discuss or explain a little more about the cultural safety practices around death and dying? So for those care providers working on site, what is it that they need to know, and can we talk a little more about that?
So thank you for that.
Thank you. We'll start with you, Victoria, and then turn it over.
Yeah, thank you for that really great question, really important. I'm going to ask Verna or Sandra if they would like to speak to that.
With regard to the Gitxsan people, this is Verna Howard. We have a matrilineal system, and we have a support system also, which is a father clan. They have their roles and responsibilities that they carry out for their for anyone that is born in the Gitxsan. It's carried out. Their roles and responsibilities are carried out from pregnancy right till death. And so when we have a death that occurs in the hospital system, a number of our people congregate there to start implementing the support system, the traditional support system. Their roles and responsibilities have to be carried out. And so the hospital is usually overwhelmed by the numbers that show up when there's a death. So the information on the Northern Health website with regard to the videos that we produced will be helpful to review, because this is not just particular to the Gitxsan Nation. There's also many other nations that have their own approaches with their how they take care of their loved one when there's been a death. And so I recommend that you navigate to the website and follow that, because that will share a lot of the information that we have with regard to the roles and responsibilities of each nation with regard to death, and then how they carry out their responsibilities. I'm not sure that really helps you at this moment, but it's a very in-depth to go through, and that would be another whole presentation on its own.
Thank you for that, Verna. And that video is, I agree, a really great introduction and a good watch for those that are interested. Sandra, did you want to add anything at this time around that topic?
Sure. I do have some information on the death and dying. The concept of soul was mentioned in one of the focus groups, in which the participant said his grandfather, a well-known healer and knowledge keeper, told him that there's a little bird that rests on the left side of the heart near the shoulder. This bird is like the soul. Consequently, the bird's soul can be harmed or stolen or simply fly away. A lost soul could result in illness, derangement, and eventual death. This came from Denny's participants. Several of the focus group participants discussed the use of singing, drumming, smudging, burning, and presenting tobacco and prayer during death and after. Singing was a common way to help the soul move on to the next round. This is feedback from our Cree, Soto, and Dene participants. Smudging was a way of sending prayers to the Creator and for ritual cleansing. The smoke carries a prayer. Tobacco is presented as a form of thanks or for giving prayers to the Mother Earth, or the person, elder, knowledge keeper, who is giving the prayer. Sometimes it is given in the left hand because it represents the heart. Traditionally, when somebody dies, they are buried in moose hide and their eyes closed. For a medicine man, everything he owned would go with him. Sometimes spirit houses were built over the buried bodies. Timing of the burial, midday often, and placement of the head, example, in the direction of the rising sun, was another consideration. After someone passes, there are up to 3 feasts. So one feast was immediately following after the person passes, in which close family and friends attend. Another feast is held on the day of the funeral, and the third feast is held on the birthday or a year later for remembering. And this comes from our Soto, Cree, and Dene participants.
I'd just like to add something. Oh, go ahead, Sandra.
No. And just in reference to birth, typically children did not attend births in most cases, but men could attend if there wasn't a midwife to assist. Women did not have to work for a long time after giving birth, maybe up to 10 days. People helped them so they could rest and heal. and the response in here is not like nowadays. They kick you out. No one teaches new moms. After the baby is born, the mom was given Labrador tea and root tea to stop contractions. A binder was placed around the stomach to stop contractions. And for some of the young moms, the moose bone and marrow was provided to them for calcium. They knew back then that calcium and iron were important. And prior to European contact, none of our women use formula or provided other types of milk. And go ahead, carry on, Victoria.
Thank you. That's just really rich. Thank you. I just wanted to note that these are excellent examples, and that you know, we have so many nations across the north, and each is unique, and each family and an individual is unique as well. And so one of the things that is really clear in some of the videos that are being created is the importance to ask. You know, if you're unsure, ask the person, the family, you know, are there protocols or traditions you carry out, and how can we support you so that it can be tailored to the unique needs of each person.
Great, thank you, Victoria. Do we see any hands up or any other questions coming in the chat box? Please don't be shy. We want to hear from you. We have a second question from Katie. This is a really great one, and I think it could potentially be for all of our panelists. And that is, the question is, how are you working with hospitals to allow for ceremony, smudging, families, and other traditions to take place within those settings? So I think we heard that touched on a little bit, but are there folks willing to tell us a little more about that?
Victoria, I can start us off and then let my other speakers contribute. We're working currently on a clinical practice guideline around smudging in our facilities. So that's a work in progress, and hope to be able to share that in the near future. Is there anyone else here who would like to talk about that?
With regard to the GITS, it's Verna Howard. We don't necessarily do smudging within the hospital system. It's more of a private thing for our people. So you most likely wouldn't see the GITS doing that in the hospital. There may be some that have adopted the Cree way of doing things, so there may be a few that will do the smudging, but majority of GITS would not do that.
Okay. I think this is Sandra here. I know that there's still a few barriers at the hospital here in Fort St. John in doing smudging. You have to work around the parameters that you're given. But overall, you know, it's working quite well. We have some of our people sometimes just going out and smudging or wheeling their loved ones outside for smudge, because sometimes they want to do it right away, and it can be done quite as quickly as we'd like. But Northern Health in Fort St. John here, our partners are working hard to change that approach or work with us on shortening the wait time. Okay.
This is Hilary.
Yeah.
Hi, sorry to interrupt, Victoria. This is Hilary, and I was just wondering, Victoria, if you might be interested in sharing a bit about how the Sacred Spaces and Gathering Places booklet was developed, because I understand that you worked quite closely with health service administrators in hospitals across the north to find out what spaces were available for larger gatherings in each of the facilities, as well as which hospitals and long-term care homes had could provide spaces for smudging.
Thank you, Hilary. Yes, so that is true. Like we did definitely connect with our health service administrators and find out how they can accommodate families to gather, for example, accommodate ceremony, smudging. And so that's all listed in the booklet that Hilary mentioned earlier called Sacred Spaces on our website. So it's been a very collaborative process, and again, a good place to start with to have discussions with patients and family and with our health staff.
Great. Thank you very much for that. We're nearing the end of our collective engagement here, and I think we have time for about one more question before we sort of move into wrapping up our session with a prayer. Is there any outstanding burning questions? Well, thank you again to Northern Health, the BC Patient Safety Quality Council, and our own FNHA team members, Victoria, Hilary, Sandra, Verna, and Sue is working in the background. We're putting together this great learning session for us all. In order to close it out, I'd like to turn it over back over to Verna for our closing prayer. Just so you know, we welcome your feedback, and there's a survey upon closing your webinar window that you'll be prompted to give us a bit of feedback, so we encourage you to do that as well. So thank you all from the First Nations Health Authority and all of our partners. Verna?
Thank you. Davis? We'll do prayer now. Pray to God, we give thanks for those that are doing the work to share with others with regard to cultural safety and cultural humility. We give thanks for all those for their openness to participate and learn more about cultural safety and humility. And we pray for your continued guidance and support to all so that they can carry their work forward in a good way. And we give thanks for this beautiful day and all those our respective family members. We ask for their continued care and guidance we pray this in your Son, Jesus Christ's name. Amen.
And thank you very much. And we will see everyone hopefully on July 5th.
Thank you.
Thank you, and good afternoon, everyone.
Thank you.